Hello everyone, welcome to today's class. Today we are going to discuss about one of the most important topic in critical care nursing as well as for the all competitive examinations, that is the ABG analysis. So that is arterial blood gas analysis. So before learning the abnormal values, first we need to understand what ABG measures and how our body maintains acid-base balance. Then only we can easily identify how our body maintains the acid base balance. Then we can easily identify the abnormal conditions such as respiratory acidosis and alkalosis and metabolic acidosis and alkalosis. Let's see what is ABG. Before going to see the ABG, very important procedure we have to do, that is the Allen test. So what is the purpose of this Allen test? Before going to puncture the radial artery, we need to know the patency of the ulnar artery. So before going to take the arterial blood from the radial artery, we need to check the ulnar artery patency. For that, we are going for we are using this test, this procedure, a simple manual procedure, that is the Allen test, to check the adequate flow in the hand before drawing arterial blood or inserting a radial artery line. So ensures that if the radial artery is damaged, so the ulnar artery can still supply the hand for to know the patency of the ulnar artery. So before puncturing the radial artery, we need to assess the ulnar artery patency. That is very important. So for that, we are doing the simple manual procedure, that is the Allen test. So let's see the procedure. Ask the patient to clench their fist rightly to empty the blood from the hand. So compress the both radial and ulnar artery at the fist with firm pressure. So our healthcare provider, whoever it may be, so that he or she has supposed to uh, we have to give the firm pressure and we have to block the complete blood supply to the hand. We have to block both the artery supply to the hand. Ask the patient to open the hand. At that time we can see the hand will look pale. Okay, so after that release the ulnar artery. Release the ulnar artery, keep radial compressed. So we have to keep our hand, we have to keep the radial compressed, and we have to leave the ulnar artery. So at that time we can see, observe the color turn to 5 to 15 within 5 to 15 seconds. So that indicates that is the enough circulation to the hand by ulnar artery. So this is the simple manual test we are using. So normal, that is positive Allen test, hand quickly regains the color, good collateral circulation, safe to puncture radial artery. So if it is abnormal, that is negative Allen test, means hand remains pain, poor collateral flow. So we have to think that is do not use radial artery for puncture. So if the ulnar artery have some not sufficient collateral flow, we don't go for the radial artery puncture. For that, we are doing the simple Allen test procedure. So let's see the what is the acid base balance. So acid base balance, the body's way of keeping right way of acids, that is the H plus ions and base is HCO3 in the blood. So ABG, that is why this ABG, acid blood gas, what is it? So let's see. So ABG is a blood test taken from a artery to assess, for why we are taking the artery blood, to assess what are the things. Oxygen, how well oxygen reduces the blood, how well the oxygen reaches the blood, and how well carbon dioxide is removing from our body, and whether the body is acidic or alkaline. To know all these things, we are checking the acid ABG analysis. So the ABG analysis, that is imagine the body as a factory, and every second cells produce energy need for life, and carbon dioxide, that is a waste product. So we need oxygen as well as we have to remove the carbon dioxide, whether the body is means reaching oxygen reaches the body, uh, reaches the blood clearly, or we need to know the carbon dioxide is removing correctly. For that we are assessing the ABG analysis. So if carbon dioxide stays too long, think that is okay, if the carbon dioxide stays too long inside the body, blood becomes what then blood becomes acidic. If the carbon dioxide leaves, blood becomes alkaline. So this is a simple thing you can keep in mind, that is a carbon dioxide stays. If the carbon dioxide is increasing in the body, what will happen? The blood becomes acidic. Okay, the blood becomes acidic. And if the carbon dioxide, too much carbon dioxide leaves, means carbon dioxide amount is decreasing, means the blood becomes acidic. So this is the simple thing you can keep in mind for easy, the easy reminder, as you can keep it as in your mind. And the body continuously balance this using how lungs control the carbon dioxide and the kidneys control the bicarbonates. Okay, think that our lungs is what controlling the carbon dioxide, as well as our kidneys are controlling the bicarbonate. Okay, so the if the carbon dioxide and the bicarbonate level is normal, think that ABG is, check whether the balance is, then we can say that the ABG is normal. Okay, so is the patient is getting enough oxygen? Is breathing is normal? Is blood becoming acidic or alkaline? So are the lungs functioning properly? Isn't it? Are the kidneys are compensating? So to know all these things, we need to check the ABG analysis. So if normal pH of our body is 7.35 to 7.45, so slightly alkaline is our blood. Okay, so this is the normal pH of our blood. So we have to by heart the values of pH and other bicarbonate, other than that oxygen saturation values and all, we have to by heart. So this is very important topic. You will get a one question from this acid base imbalance area. Okay, so if pH goes below 7.35, then we can say that this blood becomes acidosis. And if the pH goes above 7.45, we can say that is a alkalosis. Even small changes in pH can affect the enzymes, muscles, including the heart and the brain function. So this ABG mostly we are done in what? Where? In which are the areas we are mostly doing? We are done in ICU, respiratory distress areas, okay, and the COPD patients, for ventilator patients, diabetic ketoacidosis patients, sepsis patients, heart failure patients. So most of the time we are doing these things to this type of patients, commonly done in these areas. Okay, this patient suppose we have to do commonly. Okay, so acid base balance in that buffer, first line immediate action, the bicarbonate buffer system is the main one. So this is a normal thing how this one is adjusting our body. Okay, if blood is too acidic, what will happen is HCO3 will binds the H plus and the blood becomes is too alkaline. What will happen? So it will release. Okay, H plus will release and H2CO3. Okay, so this is the normal bicarbonate to make the blood as HCO3 binds H plus. If the blood is acidic, if the blood is too alkaline, H2CO3 releases H plus. Okay, so this is something chemistry. Just we have to keep it mind for understanding purpose only. We will not get any direct question from this area of normal part. We will get most of the time we are getting the question from the acidosis, alkalosis, abnormalities. So let's see what is happening, the normal things. Okay, so control the lungs, water. Second line thing is what? Lungs control the amount of carbon dioxide which acts as an acid. Fast breathing, hyperventilation. So our lungs will do fast breathing, that is hyperventilation, blow off the carbon dioxide and pH goes up, and less acidic. Okay, so once the pH go up, the blood become what? Alkalosis. Isn't it? Less acidic means that is goes up means it will blood is going to the acido-alkalosis stage, right? Next, slow breathing. The patient is not getting the sufficient breathing, that is hypoventilation. That means retain the carbon dioxide, pH goes down and the blood becomes more acidic. Think that is the acidosis condition. Okay, so think it's a simple thing. Hyperventilation, if the patient is having hyperventilation, fast breathing, hyperventilation, what will happen? Less acidic, that means the blood will go for alkalosis stage. Okay, slow breathing, that means hypoventilation, then pH goes down and more acidic means the patient's blood will going to acidosis stage. Okay, so this is the these are the things main balance. This is the normal things happening in our body balancing. Okay, kidney, that is the third line. Kidneys have the third line area, okay, to balancing the acid base balance. Okay, so regulate HCO3, that is a base, H plus, that is the acid. Okay, if the blood is acidic, kidneys retain HCO3. What will do? The blood is acidic, kidney retain HCO3 and excrete more H. If the blood is alkaline, if the blood is alkalosis, if the blood is in alkalose condition, what will happen? Kidneys excrete the HCO3 and retain the H plus. Okay, so this is the thing, this is the balancing. This is the normal thing, whatever I have explained, buffer, lungs and kidneys, that is the normal thing happening in our body. So this is the long-term regulator of pH. Okay, so this is a normal thing. This is a normal thing. I am not discussing the abnormal things. So next, I am going to start with the abnormal acid-base imbalances. Okay, before that, by heart these values. Normal ABG values, pH 7.35 to 7.45. That is the normal value of blood. Sorry, pH of our body, blood, and PaCO2, that is the respiratory component, 35 to 45 is the normal partial carbon dioxide value, that should also by heart, and HCO3, that is the bicarbonate, 22 to 26 M equivalent per liter. So these values help identify if imbalance is respiratory or metabolic. So if it's anything imbalancing in the HCO3 bicarbonate, we can say that is the what? Metabolic. And if it is imbalancing the carbon dioxide, we can say that is something related to respiratory. Okay, so these values help to understand whether it is a respiratory or metabolic issues. So buffer fix immediately, lungs fix in minutes, and kidney fix in hours to days to keep the pH stable. So this is the normal thing. Buffer will take immediately, action is taking, and lungs will fixes in minutes, and kidney will take hours to days to keep our pH stable. So up to this is the normal thing. Whatever I have discussed is a normal thing. We start with the abnormalities of that. First one is respiratory acidosis. So what is a respiratory acidosis? Thing that is too much of carbon dioxide and too much of acid. Okay, so respiratory acidosis means that is too much of carbon dioxide and too much acid. Okay, so acid is also very high and the carbon dioxide also high. So when carbon dioxide will be high in our body, think. So low pH due to the retention of carbon dioxide, that is hypoventilation. So respiratory acidosis occurs when the lungs cannot remove enough carbon dioxide. Okay, so thing that is very important, cannot when our lungs cannot remove enough carbon dioxide. Okay, so what will happen? Carbon dioxide stays in our blood, isn't it? Combines with the water, forming carbonic acid. Okay, and blood becomes more acid. Clear? So once the carbon dioxide will increase in our blood, what will happen? Carbon dioxide stays in the blood. It will combine with the water in our body and forms the carbonic acid, and our blood becomes what? Becomes acidic, that is respiratory acidosis. So carbon dioxide level will be increased. Partial carbon dioxide we can see more, and the blood becomes what? It will be becoming carbonic acid and it's going to acidic stage. So pH will be decreasing, isn't it? Less than 7.35. Clear? So pH will be decreased and the partial carbon dioxide will be increasing in the respiratory acidosis condition. Okay, how I have explained? When the lungs cannot remove enough carbon dioxide, what will happen? This carbon dioxide will be stay in our blood and combines with the blood water in our body and forming in carbonic acid, and blood becomes acidic. Clear? So ABG findings will be pH will be less than 7.5. Partial carbon dioxide will be more than 45 mmHg, and HCO3 will be normal, or sometimes we can see compensated increased level of uh, bicarbonate. So not in all condition. Okay, and what are the clinical features we get? Most of the main common causes will be COPD patient, isn't it? COPD patient have a what? Hypoventilation, isn't it? Asthma patient, emphysema patient, respiratory depression patients, means anesthesia, if any drug overdose patients. For that patients also we can expect the respiratory acidosis, airway obstruction patients, pneumonia patient, athletics. Okay, so athletics, so not athletics, athletics patients. Okay, so for these all patients we can see hypoventilation. So these patients have a chance of getting a respiratory acidosis. Clear? So for that, what are the we can see the main symptom. What are the symptoms we can see? So as I said, the pH value will be decreased and PaCO2 will be increased. We can see retention of carbon dioxide by lungs, hypoventilation, that is a decreased level of oxygen in the body. So we can see confusion, headache, confusion, drowsiness, hypoventilation, dyspnea, hypoxia, tachycardia, dysrhythmiasis. Isn't it? Rapid shallow respiration because of hypoventilation. Next, decreased BP with vasodilation. Dyspnea we can see patients. Headache, hypokalemia, dysrhythmiasis because of increased level of potassium. We can see abnormal heart rhythms. And drowsiness, dizziness, disorientation because of insufficient oxygen level in the body. Okay, oxygen level will be decreased and carbon dioxide is increasing. That's why we can see drowsiness, disorientation, dizziness and all things in these patients. Okay, so and the patient will say that I can't catch my breath. Okay, that means I can't hold my breath. Okay, because of the decreased level of oxygen, that is hypoxia. Okay, so next condition is respiratory alkalosis. Okay, so this condition is just opposite to the acidosis we can see. Okay, high pH due to the loss of carbon dioxide, hyperventilation. So what will happen? Too little carbon dioxide. So in acidosis, I said that is a more carbon dioxide. Here, not having sufficient carbon dioxide in the body. Okay. High pH due to the loss of carbon dioxide, hypoventilation. Too little carbon dioxide, blood becomes alkaline. So we can say that occurs when patient breathes too fast and removes excessive carbon dioxide. So fast breathing will lead to too much of carbon dioxide lost and acid will decrease from the body and blood becomes alkaline. Okay, that is the path though behind the alkalosis. What is happening? Fast breathing, hyperventilation. Hyperventilation, fast breathing will lead to too much of carbon dioxide lost and acid will decrease in the body, and what will happen? Blood becomes alkaline. So that's why alkalosis. Okay, the pHO will be more than 7.5, the pH, and carbon dioxide will be low. As I said, the loss of carbon dioxide, hyperventilation, carbon dioxide will be decreasing in this condition. Okay, so pH increasing, that's why alkalosis, and carbon dioxide is decreasing, that's why respiratory alkalosis condition. So, and bicarbonate will be normal or sometimes compensating with the for compensating with the carbon dioxide, we can see decreased. Okay, so more than the compensating mechanisms, it's very important about we have to it's very important pH and PaCO2. This is the main two values you have to keep in mind. So during the time of alkalosis, if the pH is increasing, that means alkalosis only. So if the alkalosis and there is no change in the bicarbonate and the PaCO2 is decreasing, means that is respiratory alkalosis. Okay. So clinical features we can see in these uh, patients is lightheadedness, dizziness, numbness, tingling in hands and face, okay, and palpitation, chest tightness, and seizures. In severe cases, we can see the seizures. Lethargy, confusion, deep rapid breathing, lightheadedness, nausea and vomiting, tachycardia, that is increased level of heartbeats, and hyperventilation. BP sometimes will be normal or sometimes will be hypo, and hypokalemia we can see, that is the decreased level of potassium, and very important thing is decreased carbon dioxide and increased pH value, loss of carbon dioxide from the lungs, that is the hyperventilation. Okay, so for that, a main important management we have to do is reassure and calm patient. Paper bag breathing, we have to give a paper bag uh, to the patient. This is a very most of the time we will do this is in an emergency situation. Paper bag breathing, rebreathing carbon dioxide, so this will help to rebreathing. So the patient will rebreathe the same carbon dioxide, and that will help to increase the level of carbon dioxide. So this is an emergency. This paper bag breathing most of the time we will do in the casualty settings for a immediate as a first aid for the patient. Okay, and reassure and calm and quiet environment we have to provide the patient. So, and treat the underlying cause. What is the cause? Anxiety, or is there any panic attacks? Is the pain is the reason, or fever, or sepsis, or high altitude, or mechanical overventilation? So we have to treat for the underlying cause. That is very important. And okay, I think respiratory acidosis and alkalosis are clear to people. And the next main important condition is metabolic acidosis. So what is happening in the metabolic acidosis? Low bicarbonate and excess acid. Okay, so that means occurs when the body too much acid outweighs too much bicarbonate. Okay, low pH due to excess acid or loss of bicarbonate. So what are the causes? So how this one is why what is the reason? What is this? Acid accumulates and base decreases. At that time what will happen? Blood becomes acidic. So we can see in this pH will be decreased. We can see pH decreasing more than less than 7.35, and the bicarbonate decreasing less than 22 m equivalent per liter, and the partial carbon dioxide will be decreasing as a compensatory hyperventilation. So what are the causes for this is diabetic ketoacidosis, renal failure, severe diarrhea, lactic acidosis because of loss of bicarbonate through this severe diarrhea during the time. So clinical features we can see is Kussmaul's respiration, deep rapid breathing, deep rapid Kussmaul's respiration. Body tries to remove the carbon dioxide to reduce the acid. That's why Kussmaul's respiration we can see. And weakness, acid affects the muscle function, so that's why weakness we can see. Confusion will be there for the patient. For low BP will be, hypotension will be there, arrhythmias we can see, confusion, brain function will be affecting, lethargy, nausea and vomiting. So these are the symptoms. Changes in the level of consciousness, as this is a Because of low pressure, because of poor circulation, we can say the changes in the loss of a conscious event. Okay, so and the management for this management is treat cause, underlying cause. If the patient is having DKA, then go for insulin. The reason is the renal related issues, then go for dialysis. If the reason is for related shock, then we will manage with the fluids. Other than that, IV soda bicarbonate we can give if the patient, if the very in the only in severe condition only we will go for the bicarbonate, IV bicarbonate. Metabolic acidosis. So I think respiratory alkalosis and acidosis is clear. So we will start with the metabolic alkalosis. So what is metabolic alkalosis? So this high pH due to the excess bicarbonate or loss of acid. So high bicarbonate or too much base. Okay. So that is metabolic alkalosis. So what are the causes we can expect? So why this one is happening? So that is also very important. Patho. Okay, why this pathophysiology of this metabolic alkalosis? So acid decreases or base will increases. Okay, acid decreases or base increases. At that time, blood becomes alkaline. Okay, blood becomes alkaline. Okay, acid decreases or base increases. At that time, what will happen? Automatically, the blood becomes alkaline. Okay, so the main cause for these things are prolonged vomiting, gastric suctioning. So during the time of gastric suctioning, too much of loss of hydrogen ions will lead to what? Acid decreases. Okay, hydrogen, loss of H plus ions. So acid will decrease. At that time, what will happen? Blood becomes alkaline. Okay, and excess antacid intake, diuretic therapy. Diuretic therapy, loss of during the time of diuretic therapy, what will happen? The kidney will excrete what? Potassium as well as the hydrogen more. Okay, diuretic therapy. So during that time also, one of the cause and hypokalemia. Okay, during the time of hypokalemia, potassium decreased level of during the time of decreased level of potassium. That time also, that also one of the cause. Okay, and how the findings will be. As I said, this is the alkalosis condition. pH increased to 7.45. More than alkalosis condition means blood should be, the value should be more than 7.45, and HCO3 will be increased more than 26 m equivalent per liter. So along with the pH, HCO also is increasing. So for compensatory hypoventilation, we can see the partial carbon dioxide, that is carbon dioxide also is increasing, we can see in the metabolic alkalosis. So clinical features we can see is muscle cramps, tetany, tremors, confusion, irritability, hypokalemia, signs, that is weakness, arrhythmias. So potassium is very important for the normal heart functioning. So we can see the weakness and arrhythmias if the potassium is low means. Okay, and pH is high as well as the HCO3 also high, that is the metabolic alkalosis. For treatment part, we need to go for the treat the underlying cause, that is the prolonged vomiting. For that, we stop vomiting. Suction, if the suctioning is the reason for the alkalosis stage, we need to stop the suctioning. So the diuretic therapy is the reason for the metabolic alkalosis related symptoms, means we have to adjust the diuretic therapy, replace the electrolytes. If the hypokalemia is the reason, if the potassium decreasing is the reason, means we need to replace the potassium. At that time we can recover the, we can relieve the these symptoms, and administer acetosalamide to increase the HCO3 or excretion in urine. Okay, we can use the acetosalamide to increase the HCO3 bicarbonate excretion through the urine itself. So for that, through that we can manage these patients. Next condition is before this, I think we need to before going to, yes, uncompensated. Okay, So uncompensated, the body has not started to correct the imbalance. Only one system is abnormal, either respiratory or a uh, metabolic. One system will be abnormal, maybe the respiratory or metabolic, maybe the other value remains normal. For example, I have given here, that is the pH 7.5, that is the acidosis condition. So less than 7.35, that means that is a decrease acidosis condition. So here we can see carbon dioxide is increasing, so that means respiratory acidosis condition cause, and normal. So this is a bicarbonate is normal. In this, respiratory acidosis uncompensated. Okay, so it's a no other values is trying to compensate here. So this is a uncompensated respiratory acidosis. And partial compensated, that is partially compensated. The opposite system is trying to help, but pH is still abnormal. All three values, pH, AC, partial pH of blood, partial carbon dioxide, and HCO3 are abnormal. In this, we can see I'm giving one example for that. pH is 7.30, that is acidosis. Carbon dioxide is 50, that is increasing, so respiratory acidosis condition. So for compensating these two, kidney is also kidney is here compensating, and the value of the bicarbonate is 30. So that is partially compensated respiratory acidosis. Fully compensated, the opposite system has corrected enough to bring pH back to normal range, and PaCO2 and HCO3 will be abnormal, but pH is normal, and pH 7.35 normal, but on acidic side, and PaCO2 50 will be increasing, and HCO3 28 increasing. Compensation completed. So fully compensated respiratory acidosis. Okay, so in this, only this will be normal, pH will be normal, and PaCO2 or HCO3 will be abnormal. So this is a just I am quick viewing, just quickly reviewing the all the topics, and let's see. Normal balance of our pH maintained between 7.35 to 7.45, and carbon dioxide value will be 35 to 45. HCO3 will be 22 to 26 is the normal thing. Normal function of lungs and kidneys, that means causes. If the patient is normal, we can say the normal pH values and normal ABG values, no imbalances. So respiratory acidosis means pH will be decreased due to the increased carbon dioxide, that is hypoventilation. So in this patient, we can see this type of ABG pattern, that is the pH value is decreased, and PaCO2 will be as increased, and the bicarbonate will be normal, or sometimes it's increasing as a compensating mechanism. And so what are the causes for the main causes for the respiratory acidosis is COPD, asthma, obstruction drug, and other disorders, and overdose of drugs, drug overdose, and lung problems also. Most of the time, respiratory acidosis will lead to related to lung problems. Respiratory alkalosis, we can see in alkalosis the pH will be increasing, and due to the decreased carbon dioxide hyperventilation, we can see the ABG pattern in this way. The pH value will be increasing, and the partial carbon dioxide will be decreasing, and HCO3 will be normal, or sometimes it will go to decrease as a compensatory mechanism. So causes will be most of the time the anxiety, fever, or high altitude will be the reason for these patients. Lungs related issues, we can say, and metabolic acidosis, and decreased pH due to the decreased bicarbonate or increased acid, that is the metabolic acidosis. So in this ABG pattern will be pH will be decreased, we can see, and the HCO3, that is the bicarbonate, decreasing, and the PaCO2 sometimes will be normal, sometimes will be decreasing as a compensatory mechanism. So what are the causes for the metabolic acidosis? That is the DKA, renal failure, or diarrhea, or shock. Kidneys or GI problem may be the most of the time the reason. Metabolic alkalosis, increased pH, and due to the increased HCO3 or decreased acid level. pH increase we can see, and HCO3 also, that is bicarbonates, also increasing. As a compensatory mechanism, PaCO2 sometimes will be increasing or sometimes it will be normal only. Vomiting and inchy tube suction and acids are the diuretics are the most of the time the reason for the causes for this condition, kidney or GI related issues, we can say this. Uncompensated, partially and compensated. So during this time pH will be, during the uncompensated time, pH abnormal, one system will be abnormal, other will be normal. And partially compensated, pH abnormal, both carbon dioxide and HCO3 bicarbonate will be abnormal. Fully compensated, in that pH will be normal, both the carbon dioxide and the bicarbonate will be abnormal. So thank you for watching, and thank you so much. Take care.